So let me first set out the big picture of where we are at in the battle against the coronavirus, and then we'll go across to our guests who are joining us, and they'll tell us what you should expect could happen and how we are doing relative to other countries. So joining us on this broadcast at this time is Professor Dale Fisher. He's an infectious diseases expert at the University of Singapore. Welcome. With us also is Dr. Gitanjali Kapoor, a research fellow at the Center for Disease Dynamics, Economics and Policy. Giridhar Babu is the professor and the head of epidemiology at the Public Health Foundation of India. Okay, this is the India Today Corona India dashboard, and I want to show you where we are at in this moment in India. So let's take the All India update first. We're about 3,000 odd cases, 68 deaths, 184 recoveries. As far as the states are concerned, it's Maharashtra that's now leading the tally of states most impacted by coronavirus at 423. There have been 42 recoveries and 19 deaths. Tamil Nadu is the state that's second most impacted with 411 confirmed cases and 1 death. Then there is Delhi with 386 cases, 8 recoveries and 6 deaths. Then there is Kerala at 295 confirmed cases. Kerala is the one state that's been relatively able to bring the situation under control. Here is where the virus tracker is globally. Remember, for the longest time, and let's just zoom in further so that our viewers can see this up and close. For the longest time, it was China that was leading the tally when it comes to coronavirus cases. Now, first Italy overtook China, then Spain, Germany, the United States. Now, all these countries have gone ahead of China. India, mercifully, is around number 30 in the global list of countries most ravaged by the coronavirus, and hopefully that's where we'll stay. This is not a race we're hoping to win. This is as far as the number of cases are concerned. Now let's look at the number of deaths. As far as the number of deaths are concerned, again, China was most brutally impacted, but it's countries like Italy and Spain that have really had to pay a very heavy price over the last several days. In India, the mortality level still relatively under control, but it's been said by people in government and outside that India is particularly vulnerable given the density of population, given the relatively poor state of our public health system. So, I want to show you now the two most important data markers which give you a sense of where we are at and where we could be headed next. So, let me show you where India stands vis-a-vis other countries of the world first. This is the India Today Data Intelligence Unit trajectory tracker. It gives you a sense of whether we're being able to flatten the curve or not, and that's what everybody's been focusing on. The steeper the incline of this curve, the more the spread of infection, the faster the spread of infection. The less the incline, the more you seem to have things under control. So the country in this blue is Korea, South Korea, and there you see, relatively speaking, they've been able to flatten the curve. China as well has been able to, relatively speaking, flatten the curve. In India, we're now on a four-day cycle, which means every 4 days the number of infections are doubling. So that's a problematic area to be in. I want to show you the state-wise trajectory tracker. Now this is very crucial. Just bear with me. Allow me to get into the depth of what I'm trying to show you, and then we'll talk about it. Now, there are two reference lines on this screen. The first reference line is the dotted blue line. This is the line your state would be on if the number of cases, just come closer, if the number of cases is doubling every 2 days. That's the dotted blue reference line. There's another reference line, which is the dotted red reference line. This is where you will be if the number of cases would be doubling every 5 days in your state. So if you're below this, it's a good space to be, which means the number of cases are not doubling every 5 days. It's taking more than 5 days for the cases to double, which is a good space to be in. And if you're on this side, it means that the number of cases is doubling in less than every 2 days, which is very problematic because it means that the infection is spreading fast. So it's in Tamil Nadu and Andhra Pradesh where just over the past few days there's been the sharpest spikes. At this moment, the greatest vulnerability is for Tamil Nadu and Andhra Pradesh. Now, it's states like Kerala which saw a huge spike towards the 10th of March, where they've now been able to relatively speaking, and I hope it stays this way, bring the curve under control. Maharashtra also is seeing, just if you come closer, you will see a sharp jump right towards the end. This is just over the past 72 hours where the cases in Maharashtra have now started jumping, and that is problematic because Maharashtra is now really seeing, just over the past some time, a big spurt, and there have been cases in Dharavi as well. The other state that's problematic is Delhi, where again, if you see, there's been a sharp jump. This curve is a sharp jump, and that's problematic too. So that's the broad sense. But you know, and there was a very important point that an epidemiologist made earlier. Just because your state is not on this tracker, it doesn't mean that you're safe and well, because things could change. States like Tamil Nadu, states like Kerala have a relatively better public health system. When this moves to Bihar or Uttar Pradesh, it could change. So just because you're not at this moment in an area where the curve is on a very sharp incline, it doesn't mean that that's the way it will stay. Okay, now that I've set the context, let's go across to the guests who are joining us on this broadcast and understand from them what they're making of how India is doing. Professor Dale Fisher from the University of Singapore, Dr. Gitanjali Kapoor from the Center for Disease Dynamics, Economics and Policy, Dr. Giridhar Babu from the Public Health Foundation of India, and Siddharth Chandra, Professor at the James Madison College in Michigan University. So welcome to all our guests. I want to go across first to Dr. Siddharth Chandra. Sitting where you are, what's your sense of how India is doing in the battle against the coronavirus so far?
So I think India is in a difficult situation because of our very large and dense population. I think that the measures that the government took to impose a lockdown, those measures were really wise measures. They were done relatively early in the game, which is very important to do because these epidemics have a way of expanding exponentially across populations. So that was a very good move. I think the state of surveillance in India, given the level of economic progress in the country, is actually quite good. But there are, of course, many problems that India faces because of the particularities of a very large population, a very diverse country in terms of the federal structure. So overall, I think India is doing what it can do. I think the government is in a very difficult situation. There are many issues economically related that it still needs to work on. But I think imposing the lockdown was absolutely the right thing to do from the epidemiologic standpoint.
Professor Dale Fisher, you've looked at how Singapore has dealt with the coronavirus. Now, India, of course, a country far more complex, far more populous than Singapore. But given where you're at, how do you see India's response to the coronavirus so far?
Thanks, and thanks for having me on the program. Every country, every city in the world, every corner of India, they've really got their own outbreak. And I think India is going to see a different style of outbreak and outbreak response, as is Europe, as is other parts of Asia, China, Africa. Everybody has different capacities. Everyone has different densities. There's no doubt India has incredible challenges. But at the same time, they've got a lot of capacities. From my understanding, I think lockdown was a very good thing. There's two reasons to lockdown. One is when you feel that the outbreak is just getting out of control. So it's time to just settle things down. In Singapore, we've done a relative lockdown recently where we're calling it a circuit breaker. It's not because our hospitals are overwhelmed. It's because we just feel like we're losing touch with our ability to contain. So we impose social restrictions. But other countries, Italy, Spain, New York, they're really locking down because their capacities are overwhelmed. So clearly it's a good thing if you feel like you're losing control to lock down early.
Dr. Gitanjali Kapoor, what are you making of the manner in which this lockdown has gone so far? And relatively speaking, in India, the infection seems to be more under control than it is in a country like the United States or Spain or Italy, which is counterintuitive to what we would have expected ordinarily. Why is that the case, and do you think it will stay that way?
Thanks, Rahul, for getting me on the show. And I'm representing Center for Disease Dynamics, Economics and Policy, CDEP. That's an independent organization with a mission to produce independent multidisciplinary research to advance the health and wellness of human populations. So answering your question, actually, where are we going to head to would be, I think, primarily whether it's after the lockdown or if it's even after a few weeks. It basically would be depending on two very important factors. The first would be how well prepared are we in terms of our health system infrastructure, the number of beds, the ICU beds, the number of ventilators, isolation rooms, the PPE gear, our testing kits. All this needs to be determined. What is our current capacity, even if COVID was not there? But now with the COVID striking us, we definitely need to ramp up and be sure that we have enough facilities to accommodate mass hospitalizations if required, as we are seeing in other countries. And second factor that's going to really determine where we head to would be how well we are complying as a citizen, individually and as a nation, to basic infection control strategies such as hand hygiene and social distancing. So these two are very important factors. And coming to the first point, that's the lockdown that has been imposed in India. Of course, as my previous speakers have said, a very bold move, a very wise move. And in fact, it's giving us a golden opportunity to buy time, because this is a time where our policymakers and the healthcare stakeholders, they really need to strengthen and expand the current healthcare infrastructure so that we are confident that we're moving in the right direction.
Dr. Giridhar Babu, it's a midway of sorts. The Prime Minister's 9 minute, 9 baje, Sunday at 9 p.m. In what you've seen in India's response to the lockdown so far, how is it in contrast to your expectations from how things would be? And relatively speaking, with all the modeling that you're doing, do you think we're doing a good job of keeping the infection under control?
Yeah, Rahul, if you have to see the entire scenario starting from the lockdown, this entire outbreak of coronavirus, not just in India, all over the world, has been giving up sort of many new learnings to many countries. So India also did have its own share of learnings. So to begin with, the understanding was lockdown was not necessary when India took the decision of starting the lockdown. And after that, what we have done so far is, lockdown is basically like a wall which controls, how many infections at what rate they come into your community. And in that, we are able to do really well. And from now on, we will see the results of how lockdown has been. But equally important, and where I disagree with some of the infographics shown earlier, my worry is not those states which are reporting good number of cases. That means those states have a functioning surveillance system. Those states also have the highest testing rates compared to anywhere in the country. Those states also have least mortality rate, case fatality rates when it comes to, because they detect early, they hospitalize early, therefore the outcomes are really good. My real worry is in terms of containment, the states which are not doing well, the states which have less than 15 or 10 tests per million population, where suddenly the deaths have started being reporting lately. So Rahul, if there's one death, there are other 100 infections which have occurred nearly 17 days ago. So now if you don't track for the last 17 days, those 100, even if they've contributed to one more person, there are 200 people. So therefore, what we need to be doing right now is find more cases and then isolate them. So
that's an important point that you made. That's a very important point that Giridhar Babu made. And I refer to that when I was explaining the data sets to you, that don't just look out for where there are cases, even if there aren't cases being reported, but deaths are being reported. That's even more problematic. So Dr. Babu, as I shift our attention to the second part of this broadcast, I want you to focus now on where you think the trajectory tracker in India is going. Between this weekend and the end of this national lockdown, if things stay the way they are, from all the data that is available, where do you think we're going next, sir?
So in terms of, again, now if we have to detect more cases, we do not have any magic wand to make sure that the tests are available everywhere. We can't be stepping up infrastructure everywhere within a matter of few days. But what we can still do is something that India has been very, very well proficient in, is looking at symptom complex and finding out. We have done that in polio, we have done that in other disease programs. Now is the time for us to look at disease in terms of symptom complex. Who has fever? Who has cough? Do they have a case definition that fits into COVID? Let us do home isolation. Let us look at their contacts. If we are able to do this containment procedure for the next whatever number of days we have in lockdown and beyond, we will be able to interrupt the transmission. This is the golden opportunity for us that the lockdown has given. The rate of transmission has reduced. If we are able to identify the other cases through our own strength of India, which has been through syndromic approach, I think we should be able to contain
But I want to go across to Dr. Siddharth Chandra, because the problem here is you can't suddenly substantially boost capacity in the middle of a pandemic. So how do we make the most of what we have, realistically speaking, to keep the tightest watch on this infection and to stop its spread as much as we can?
Okay, that's a very important question that you ask. And I'm going to answer it in two parts. The first is, this is not India's first experience with a pandemic. In fact, quite recently in 2003, when we had the SARS coronavirus epidemic, the Deputy National Security Advisor of India actually spearheaded a task force to, they created a government report, probably the first Government of India report on how to address pandemic situations. And I think you're absolutely right. So our problem is in the immediate, in the present, we probably don't have the ideal infrastructure to manage the pandemic, right? So I would highly recommend that people take a look at the report that was written. It emphasizes three things. One that our colleagues on this panel are emphasizing, and that is the expansion, the creation of surge capacity in our public health infrastructure. This is critical. A second is, and this is extremely important, at the end of the day, what is going to save us is vaccination. An increased investment in vaccination research, the development of technologies indigenously to create vaccines more rapidly than we are currently able to, and then a seamless pipeline into the pharmaceutical industry, again, to indigenously produce vaccines. Let me answer that. Now, let me bring a second part to this, because this is extremely important. We're caught up in the present. We need to think about the future, okay? We have a novel virus here. And with a novel virus, everybody in the population is what epidemiologists call susceptible, okay? And many of us are being exposed to it. And of the people who are exposed, many will be infected. And then ultimately, when they're infected, most of them will recover and be immune, hopefully. And some will be, unfortunately, will die and be removed from the population. This is the basic framework of epidemiology, okay? Now, what happens when you impose a lockdown? The good news is you flatten the curve and you don't overwhelm the health system. But what you are also doing is you're maintaining a population of susceptible people out into the future. And so the degree to which you relax these restrictions is going to determine the degree to which the pandemic has the capability to take off again. I say this because this was observed in 1918 in the United States of America, when lockdowns were imposed for the influenza pandemic of 1918, and then in some cases lifted somewhat prematurely. There was an immediate resurgence, okay? So these are very important issues to keep in mind. The lockdown was important. We have a maintained pool of susceptibles. How do we look at the future in terms of preventing these surges from happening? And the answer ultimately is, once we bring the wave under control, is to have a very aggressive strategy of testing and diagnostics and immediately quarantining and isolating the exposed and the infected, just like my colleagues on the panel.
Now, those are very important insights from Dr. Chandra.
Problem.
No, but I want to go to Gitanjali Kapoor, and the point he makes, it's perfectly rational that once you've had a lockdown, if things go back to normal, there'll be a big spike. To prevent that, you must have very high quality ability to target whoever looks suspicious, ensure that he's isolated, quarantine them, treat them. But that's, look at Bihar. I was seeing some pictures of this person who went into a medical center and the CMO said, "Haan, tumhara checkup ho gaya, ab tum jao." But he's overwhelmed. So, you know, what may be okay in China, in Singapore, maybe even in the United States is quite inconceivable in the current context in India, and that's a reality we're dealing with. How do we overcome that as best as we can, Dr. Kapoor?
So we know that we do have a deficiency of our healthcare workers, professionals, para-healthcare professionals. I think this is the time that we need to mobilize our community health workers, our health and sanitation workers who are aware of it, so they can spread the message across to the last person. My concern is that everybody, most of us do know about the COVID, but does the common man who may not even have basic hand wash facility in his area, is he aware of the behavior of this virus? So I think we do need to convey this message across, that at least follow basic prevention. And what's basically happening is that, of course, I don't think we can ramp up. We would love to, but if we can't ramp up the testing facilities in such a short notice, the current recommendations are treat every suspicious person as COVID positive, even if you've not tested. And at least the best we can do is quarantine him, isolate him, and do a contact tracing. And I think a more cost-effective way would be, which we are waiting for, is our serological tests, because that can really go and screen in the communities and see what is the level of community spread. And we should also be moving into research in that direction, because so far every day there's a new hypothesis around this virus. And the latest, as we all heard, is that yes, it could be aerosol spread, still not confirmed, but that is what's going on. And that's why they're recommending masks now, and they've changed. So I think we all need to just stay with the latest news and spread it even to the last person who may not be aware of it in the rural areas.
In this battle, there are no easy answers, but over the past half hour, we've had some very sharp insights. For the time being, Dr. Gitanjali Kapoor, Dr. Giridhar Babu, Dr. Siddharth Chandra, for joining us on this broadcast. Thank you very much. I hope to have you back again on our network to talk about this rapidly evolving situation. I'm slipping into a very quick break right now. When we come back, we'll look at the use of big tech in the battle against the coronavirus. The government has launched the Arogya Setu app. Remember, Singapore, China, Taiwan, Hong Kong have used technology very effectively in the battle against COVID-19. India's taking some baby steps. What are we doing? What more could we do? And what are the kind of privacy issues this raises? I'll delve into that when we come back with the second part of the Newstrack this Saturday evening. Stay with us. I'm going to be back in 2 minutes.
Presented by RP Sanjeev Goenka Group, Growing Legacies.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.